Today, everyone needs to be aware of how to approach hypertension. In the past, there was a rule of halves. So, about half of the people are hypertensive. Half of those aware of their condition take medication. And we used to say that only half of the people taking medication could bring their blood pressure back to normal. Now this rule has been lifted. Why? Because nowadays there are blood pressure medications and people have become more aware. We see very few cases of diseases like hypertension-related heart failure or hypertension-related brain hemorrhage. These treatments help people regain health and maintain ideal blood pressure. There are some rules to follow when using blood pressure medication. And after these treatments, it's possible for people to regain their health and keep their blood pressure at those ideal levels we talk about. But it's important to know that there are some rules to follow when using blood pressure medications. First, blood pressure medications today are effective 24 hours a day. Therefore, the time at which blood pressure medication is taken is not very important, but we generally think that swallowing will always happen at the same time as soon as we wake up in the morning, although it may be different for everyone. What I mean is, people usually check their blood pressure and think, oh, my blood pressure is low today, maybe I shouldn't take this medication. You shouldn't do that. Also, there needs to be a different blood pressure medication, tailored for everyone. I mean, I use my father's medicine. I bought it from a neighbor. Something like this is not possible because we choose different blood pressure medications based on the underlying causes or any accompanying conditions each person has. We selected the blood pressure medications and started the patient's treatment. So, what happens if this patient goes to the doctor every other week and wants to change their medication frequently? You should wait 20 days for a blood pressure medication to take effect. Changing your medication after just 3 days because it didn't lower your blood pressure is wrong. Ideally, it's 2 months. I changed my medication after 3 days because it didn't lower my blood pressure is wrong. You need to give it time. It's been 2 months. So, if we waited a week and it didn't go down, and then we waited 2 weeks and it still didn't go down, then we can consider doing a new check. Besides that, if we've managed to regulate the patient's blood pressure really well, it would be enough for them to just come to us to get their prescriptions and have a checkup once a year.